For joining us. You're watching SA3 on SABC News. I'm Flo Litwaba. President Cyril Ramaphosa says that South Africans must be prepared for a new reality in which the fight against COVID-19 becomes part of citizens' daily existence for the coming year or more. In his weekly letter to the nation, Ramaphosa says with many more people gradually going to work during level 4, there will be an inevitable increase in infection numbers as well as demands on the healthcare sector. He says greater effort by government, employers, academic institutions and individuals will be required to manage infections. Ramaphosa says that the easing of the lockdown restrictions must not result in careless behavior by individuals or reckless practices by businesses. He says that the country will need to adapt to new ways of worshipping, socializing, exercising and meeting that minimize opportunities for the virus to spread, saying all sectors have a role in fighting the pandemic. Government says it will step up screening, testing and case management programs, as well as introduce new measures to make contact tracing more effective. All right, for more on this now, we're joined by leadership expert, Dr. Mazwe Majola. A very good evening to you, sir, and thank you as always for joining us on SABC News.
Good day, Flo. Thank you so much for the invitation.
All right. A lot of conflicting analysis about the leadership role that African leaders have played whilst we are in the midst of this global pandemic. We heard, for example, Stephen Karinga of WHO saying that African leaders have really done all that they can, considering that we're projected to have larger numbers than where we are currently at the moment. What's your analysis on African leadership in terms of dealing with COVID-19? And perhaps you could also just zoom in on South Africa specifically as well.
Well, it's a crisis. It's a pandemic. It's not an easy thing to deal with. So even leaders will not exercise any ordinary leadership skills. So they'll have to use extraordinary measures to deal with this pandemic. Leadership in a crisis. It's not a usual leadership. So leaders will use different qualities. Some of them may even be seen as autocratic because they need to be strong and decisive. They need to be tough. They need to show the people that this is a serious matter. So I think they've done quite well. To contain the pandemic. Even here in South Africa, the president has done so well so far. However, I think he needs now to provide more communication. He needs to provide a clear map that will show the whole country in terms of where are we going and how are we going to get there, and also just to assist the whole country to understand the bigger picture. It's not an easy thing, but that is what the cost of leadership is. Leadership is not an easy thing, so he must stand up, our president as a leader, and show decisive leadership during this time.
Dr. Majola, let's discuss the President's weekly letter. This week he has said that the focus on beating COVID-19 will now have to shift towards sort of individual behavior as the country slowly sort of gets back to work. And I mean, you're talking about the fact that he needs to provide more communication, but it does seem at this point he's sort of handing over to us as citizens. What's your take on that? Does it seem to you like you're on your own type of leadership style or attitude, or do you think that this will resonate with some citizens who have been feeling a little bit, I suppose, imprisoned by this lockdown and all the regulations that government has imposed?
I think it's quite correct that this is going to be with us for a while, and it's so true. The scientists have been saying that even to come up with a vaccine, it's going to take about probably between a year and 2 years. So it's so true that the effects we're going to feel the effects for a while. However, the country cannot be in lockdown for another 18 months. So even though we are faced with these challenges, but the government, the president and the government must provide answers. They must provide, as I've said earlier on, a clear map as to how they're going to tackle this issue, because we cannot wait until a vaccine has been found, which is going to be another 18 months or 2 years or so. We cannot wait for that. People need to go on with their lives. We need the economy to flourish. We need our social lives to go back in life. You know, there's so many things that needs to go back in life. So we've got to balance the health imperative versus the economy imperative. That is very important. I think the president has been silent a bit. We last heard him on, I think it was on the 23rd, on Thursday, the 23rd of April. It's more than 2 weeks now. We haven't heard anything from him. So as the president of the country, as the person who is in charge, he needs to come back and address the nation and take the nation to his confidence and bring hope to the nation. Communication and transparency is very important during crisis. So he must not be silent. I mean, I think his silence is very loud. So we hope that in a very near future he will come back and really and address the nation again.
Yeah, you know, you talk about the fact that in a crisis we definitely need a different kind of leadership style, because I mean, as you say, you know, the unprecedented times these are, and of course this is new for most leaders throughout the world to have to deal with a global pandemic like this, as we're currently having to deal with. So my question to you then, Dr. Majola, is what kind of leadership do you think would work in a situation like this? Are we talking about a hard sort of leadership where people are told this is what you're going to do? We've had the army come in and people crying about that and complaining about that. Or would a softer approach work in this instance? I mean, I don't know if that necessarily would work, because there are people wanting to go surfing, there are people wanting to go jogging and not realizing how serious the situation is currently. But what type of leadership would really work in this instance?
Well, he started very well. He started very well with a very hard leadership, which was needed then, and still. You still need that tough and decisive leadership.
Dr. Majola, I'm so sorry to interrupt you. I'm so sorry to interrupt you. We're going to have to take a live briefing. I hope that you'll be able to stay with us on the line. We're just taking a crossing at the moment. We're going straight to the Health Minister, Dr. Zweli Mkhize, who is briefing the media in the Eastern Cape. We did tell you that the Minister would be heading out to the Eastern Cape. 2 days ago, he was in the Western Cape, as of course the numbers are climbing there too. Currently, he is now in the Eastern Cape. Let's take you straight there.
Thank you. Also to buy a bit of time